You can also visit my playlist. In the playlist, I have provided almost all the topics in a very systematic order. You can also make use of it. Now, in the last few classes, we were discussing about uh, the fever. In the fever, we have seen certain basics and what are the important 5 points, that 5 questions that you have to ask for each and every patient of the fever. In that aspect, we have seen the onset of the fever in the last class. Now, in the onset, if it's a acute onset or if it is a mm, chronic onset or if it is in a high fever or it is a mild fever, what inference we have to take, that also we have seen. Now, if you are knowing about the onset of the fever and the parents are desperately want to suppress the fever, so now the intention of the parents is very clear. So they don't know all the theory and all those things, okay, medical importance. So for them, their child should be get relieved of the fever. But as a doctor, you know that yes, relieving the fever is not so important because fever is helping us, or actually the fever is helping the child to get over this tissue damage, and it is helping in the process of the tissue repair. So we should not do that. Rather than we should be ready for the treatment of the complications and other aspects. So this you know as a doctor, but as a parents they don't know all these things. As a parent, they desperately want to reduce the fever of their child. So if you are suppressing the fever at this particular point, then you are supporting the pathogen. You are not supporting the body. And if you are not suppressing the fever, then you are supporting the body immune system. If you are not suppressing, then you are supporting the body immune system. This fact we have already seen in the previous classes. Now, okay, onset is either acute or mild, whatever may be, but you may face another important situation. What is that? Only fever is coming for the first 3 to 4 days, no any other clues. Sir, you told that we have to identify the anatomy, we have to identify the place, etc. But this is third or fourth day of the fever. There is no clue at all. Only fever is coming. He is not having running nose. He is not having throat pain. He is not having abdominal pain. He is not having burning sensation. Nothing. There is no clue about the anatomy at all. Okay, only fever is coming. Then what we have to do? Suppose if you don't have any clue for the first 2 to 3 days or 4 days, now it can be compared to a situation where a thief has entered into the multi-floor building for robbery. Okay, multi-floor, uh, uh, what you say, building is there, hotel is there. A thief is enter into the building for the purpose of robbery, but he don't know actually where the money is. Okay, so actually the money where it is kept. Okay, so he don't know that. So now he takes some time to think and act to have a planned robbery, isn't it? So he already entered inside the building, multi-floor wall. Okay, building already he has entered inside. But after entering inside, he come to know that where exactly the money is there, he don't know. Now he will take his own time to do a planned robbery. So for the first few days, he will just going to observe where they used to keep the money, which is the weakest area, which is a suitable time to go for there, and how I have to open the key. And he is no planning actually, because he is inside the building only and he is watching everybody and he is playing there. Okay, so he is no planning. So same way, and one fine day he will come and he will going to do the robbery. Because he has to find the thief has to see where actually less police go, which is a very weak area, which is the safest time. So all these things he is planning. Similarly, a pathogen which is enter already inside the body, okay, so it is not at get localized to any part of the body. It is simply circulating in the blood. It is simply circulating in the blood. It is nowhere it get localized in one particular part of the body because it is not finding a suitable place to get localized. Okay, so therefore for the localization it is the watching for the right time. It for the localization it is watching for a weak area. For the localization it is watching for that particular area where the immune cells are less or rarely come. So the pathogen is watching all these events which is going on inside the body, and one fine day after getting confirmed that this is the safest area for me, it will go and get a settle there. Now, when the child is having only fever and there is no other symptoms, that means that pathogen is already entered inside the body, but it is not get localized. Okay, but definitely one fine day it will go into localized one to one particular area. It may be in the lungs. If the lungs, the patient, if it is get localized in the lung, then the child start with the breathlessness. If the child started with the irritability, definitely it suggests that that particular localization took place in the meningitis or meninges. If it is burning maturation, that means that its localization took place after 3 or 4 days in the urinary tract. If it is vomiting or diarrhea, then localization took place in the GIT. So like these, so same way the some pathogens after entering inside the body has to escape from the immune cells. They have to see their protection, isn't it? So it will take some time and they will move here and there. Then they will find some important anatomical place. So few days they will not localize at one place, just moving in the body here and there for the first 2 to 3 days. Therefore, we will only have the fever without any localization. Then one fine day they are get localized. Once it is get localized, then it is very clear how to treat it. So far there is only fever, but after the 4th day, one fine day you started with the vomiting. That suggests that now the infection is get localized to the intestinal area or stomach area. Okay, for the first 3 4 days there is only fever, but on the 5th day patient also started with the burning maturation. Now it is very clear that that localization has been taken place to the urinary tracts. So, so once it is localized, then the treatment is quite easier because now you know where actually you have to treat and you can give the gumshoe treatment. So previously when there is only fever, actually the child is running through the bacteremia stage. Okay, bacteremia stage. These are typical of bacterial infections. Okay, this type of fevers where there is no other symptoms, only fever is coming. Okay, there is no localization. It is very typical of a bacterial infection because bacterial pathogens, they pass through the stage of bacteremia. So bacterial infections may present with acute presentations, or sometimes bacterial infections may present with the bacteremia-like presentation. Bacteremia means they are circulating in the blood, but they are not releasing the toxins. Okay, acute presentation means they are present in the blood and they are releasing so much of that is toxins. So don't go for early medications. The idea is very clear. So don't go for early medications. If the fever is coming, just watch the fever, give some of the antipyretic, control the fever, and don't go for unwanted medications like antibiotics. Okay, so that is exactly what Ayurveda also says, that Navajvara should not be overtreated. Okay, just watch the Navagraha. Okay, so Navajvara should be watched carefully for the presentations to be followed in the next few days. Okay, if you go for unwanted treatment for the Navajvara in the early part itself, that will totally misdirect your path. So this is one important thing about the acute fevers and as well as the chronic fever, and how to identify when the only fever is coming and there is no other symptoms, why you have to watch and how you have to watch. That is very, very important. Thank you very much. We will meet in the next class.